Kamat. I'm an IVF consultant, obstetrician and gynecologist practicing at Srishti Fertility Care Center, Mumbai. So today we'll be talking about anemia. As we know that anemia is vastly prevalent in our country, and my own state, that is Maharashtra, is not in the pink of health. According to the 2019 survey, it has been found that 53% of the women are anemic, especially during pregnancy, and these numbers seem to be increasing. So then, what is anemia? Anemia is a condition in which the number of red blood cells or the hemoglobin concentration within the red blood cells is lesser than normal. It is expected that 1/3 of all women of reproductive age group are anemic. So what are the risk factors of anemia? So conditions that may lead to anemia include basically a deficient diet, which is very poor in iron, folic acid, and B12. Iron, folic acid, and B12, these are the factors which are responsible for the production of hemoglobin. So any diet which is deficient in these factors will lead to anemia. And during the reproductive age group or early menarche, when the girl experiences heavy periods or the woman experiences heavy periods, there is a lot of blood loss, and this also can lead to decrease in the hemoglobin level. Then there are certain conditions called stomach ulcers, which may bleed. There may be a lot of internal bleeding, and this also can lead to anemia. So all these factors give rise to the prevalence of anemia. Also, there are certain factors which are associated with iron absorption. Like suppose the patient has problems with her, certain problems regarding absorption in her intestine, so that iron will not be absorbed in spite of adequate intake of iron. Also in our country, worm infestation is also very common. This can also lead to anemia. Now, what is the commonest type of anemia? There are so many types of anemia, but what is the commonest type of anemia? That is the iron deficiency anemia. And when does this happen? When we do not have enough iron in our body. Iron deficiency is usually due to blood loss, but may occasionally be due to poor absorption of iron, as well as due to increase in demands. Increase in demands like pregnancy. And deficiency in folate, vitamin B12, and A are also very common. How do we diagnose anemia? So diagnosis can be made by doing a simple blood test, that is a complete blood count or the CBC, which will measure your red blood cells, hemoglobin, and other parts of your blood, other parts of the blood in the sense, other components of your blood like WBC, platelets, etc. And your doctor will also ask you about your family history, your diet, and your medical history after he sees the CBC report. What then are the normal hemoglobin levels? Hemoglobin is needed to carry oxygen. Normal hemoglobin levels during pregnancy should be more than 11 gram per deciliter or more than 12 gram per deciliter in non-pregnant women. What are the symptoms of anemia? So does anemia has any symptoms? Yes, of course, because the symptoms will again depend on the cause and severity of anemia. Fatigue, that is tiredness, weakness, dizziness, pale skin, shortness of breath are few of the common symptoms of anemia. Sometimes if the anemia is too severe, it can also lead to puffiness of face and swelling of the feet. And this happens because of too few or abnormal red blood cells or not enough hemoglobin, and that decreases the capacity of the blood to carry oxygen to the body's tissues. Clinical examination can also include looking for pallor. Pallor is paleness in the eyelids, in the tongue, in the nail beds, in the palm, etc. Now, what are the consequences of anemia during pregnancy? Now, why should we be worried about anemia in pregnancy, especially? Because maternal anemia contributes to 18% of perinatal mortality. Perinatal is the period around the childbirth, and 20% of maternal mortality in South Asian countries, including India. Iron deficiency anemia can have consequences during pregnancy as well as during and after delivery. It can also impact the fetus as well as the neonate. So what are the complications which can happen during pregnancy? That is, iron deficiency anemia can increase the risk of preterm labor and delivery. So when the delivery or the labor begins much before term, much before 9 months, that is called as preterm delivery. High blood pressure, intrauterine death of the baby or the fetus, infection or bleeding during pregnancy. So these are the few of the complications which can happen during pregnancy. Sometimes when the anemia is severe and the heart has to supply blood to all parts of the body, so the heart overworks and it can lead to heart failure as well. Then during delivery, it can prolong labor. It can increase the rates of operative delivery like forceps or cesarean section, and induced labor. When the labor pain does not start on its own, the doctor will have to give certain medicines to induce labor, fetal distress, and problems related to the placenta, etc. Then after delivery, so after delivery also there is risk of excessive blood loss, infections, failure to produce milk, depression, slowing of the process of the uterus, resuming its original shape, etc. So after delivery, the uterus contracts and it comes back to a near normal shape. But during anemia, what happens is this uterus does not contract as much as it should. And this leads to further bleeding and which causes again the severity of anemia. Then anemia in mother can impact the baby as well. It is not only with the mother, the baby also can be affected. The baby could have low birth weight or have increased risk of infections, anemia, and abnormal cognitive development or less brain growth. Now, how do we manage anemia? Now, pregnancy is a very demanding physiological state. In India, it is observed that diets of women from the lower socioeconomic groups are essentially similar during pre-pregnant, pregnant, and lactating periods. As we know, during pregnancy, there is increased demand of the fetus. But these women, they do not increase their intake of nutrients, nor do they increase their caloric intake. So consequently, there is widespread maternal malnutrition, leading to high prevalence of low birth weight infants and very high maternal mortality. Additional foods are required for weight gain in pregnancy and birth weight of infants. The mother, as well as the growing fetus, needs iron to meet the high demands of RBC formation. Folic acid taken throughout the pregnancy acid 3 months before they are actually planning to conceive. And this decreases the neural tube defects or the birth defects. The pregnant or lactating woman should eat a wide variety of foods to make sure that her own nutritional needs as well as those of a growing fetus are met. There is no particular need to modify the usual dietary pattern. So you need not really change the dietary pattern, but you need to include a few nutrients in it. However, the quantity and frequency of usage of the different foods should be increased. Mineral and vitamin requirements are met by consuming a variety of seasonal vegetables, particularly green leafy vegetables, milk, and fresh fruits. Though it is possible to meet the requirements for most of the nutrients through a balanced diet, pregnant or lactating women are advised to take daily supplements of iron, folic acid, vitamin B12, etc. Because though the diet is good in all these vitamins, we do not know how much of it is going to get absorbed. We cannot measure the amount of nutrients which are absorbed by the body. And pregnancy is a high demand condition. So that is why these women, in spite of a good diet, they need to take supplements. So a diet plan for iron deficiency anemia needs to include a healthy balance of iron-rich foods such as meat and poultry, seafood, iron-rich vegetables, nuts and seeds, and beans. It is also crucial to include foods that improve the body's absorption of iron and avoid foods that may interfere with this process. Now, what medicines are available for anemia management? So usually we give tablets, that is oral iron and folic acid tablets with or without other vitamins and minerals are usually recommended for the management of iron deficiency anemia. Pregnant women on oral iron supplements should consume the tablets before meals or at least 1 hour after the meal, along with supplements like vitamin C to enhance absorption. Is there any role for IV iron? IV iron or parental iron is also a common alternative used in cases of severe anemia, inability to tolerate iron. A lot of patients Some of the patients cannot tolerate oral iron or it is not absorbed properly in spite of regular intake. In such patients, we do advise IV iron. And patients who need rapid restoration of iron stores, the patients with severe anemia, we cannot wait for them to take tablets and then increase the hemoglobin. So even such patients require IV iron, especially in late second or third trimester, that is with moderate to severe iron deficiency anemia. Now, why should one take tablets during pregnancy? A lot of patients ask this question that, doctor, I'm taking a very good diet. Why do I need to take tablets during pregnancy? So anemia during pregnancy has been associated with poor maternal and birth outcomes, including premature birth, low birth weight, and maternal, perinatal, and neonatal mortality. Periods of high growth and development during pregnancy incur significant additional iron needs, especially for fetus, placenta, and the expanded blood volume of the mother, because during pregnancy, the blood volume of the mother increases. Women may also experience significant iron loss from bleeding in childbirth. As the extra demand of iron, especially during pregnancy, is often unmet by a routine diet, regular iron supplementation is recommended by most experts during pregnancy and as well as after delivery during the lactation period, because we don't want to take chances. Now, is it necessary to take tablets even after delivery? So most patients think that just after delivery, the job is over. So why should we take tablets? No, it is necessary to take tablets. Prevalence of postpartum iron deficiency anemia is very high in India. Untreated iron deficiency anemia during the postpartum period is a cause of maternal morbidities such as tiredness, lethargy, dizziness, headaches, lactation failure, and postpartum depression. The maternal mortality rates are also very significant. National Iron Plus Initiative recommends iron and folic acid supplementation every day for at least 100 days starting after the first trimester at 14 to 16 weeks of gestation for all non-anemic pregnant women, followed by the same dose for 100 days postpartum. We usually start iron supplements during the second trimester because during the first 3 months, the woman has a lot of nausea and vomiting. So her compliance may be poor and the iron absorption also may be poor. So we usually start from the second trimester. Some national bodies also recommend daily iron with folic acid for all non-anemic women in postpartum period for 6 months, whereas the same tablet is advised to be taken twice daily for mild to moderately anemic postpartum women. Generally, anemia in postpartum represents a dire need for iron supplementation, and in such anemic patients, parenteral iron supplementation can also be considered in treating anemia. How should one take iron tablets? Now, this is very important. It is not only important that you take it regularly, when the woman should take the iron tablets is equally important because a lot of things help or interfere with their iron absorption. So avoid taking iron supplements along with caffeine, that is coffee containing drinks like coffee or tea, then milk or milk products and antacids. So high fiber foods such as whole grains, raw vegetables, etc. So all these things, they hamper iron absorptions, and iron tablets should never be taken along with these substances. Then when should you take your iron supplements? You should always take it with a glass of orange, lime or lemon juice and has prescribed by the doctor in appropriate dosages. You can also take it with a small amount of food or at bedtime if you have a stomach upset. So there are some women who say that as soon as I take the iron tablet, I experience some stomach upset. So you can take something light, food before that, and then after that you can take the iron tablet. Remember to take your iron supplements. Keep them in your purse, car, or at the bedside. So keep it where it is handy. Nowadays, everybody has a mobile, so you can even put a reminder on your mobile to remind you to take your iron tablets. So if you miss the dose, take it as soon as you can. If it is already time for your next dose, skip the missed dose. Now, in case of side effects with iron supplements, inform the doctor if you experience nausea, vomiting, constipation, or diarrhea. Black stools are normal because the iron, some part of it is excreted in stools, so black stools are normal, nothing to worry about. But if they are accompanied with blood or cramps, you have to talk to your doctor. Do not stop taking any medicines without informing your doctor. Safety of iron supplements. Are iron supplements safe? We are asking patients to take them regularly. So are they safe? Yes. Some common side effects associated with iron supplements include constipation, dark stools, stomach upset, that is pain, bloating, diarrhea, nausea, and vomiting, metallic taste in the mouth. Of course, the newer iron preparations are very good and they have fewer side effects compared to the older iron preparations. So you can inform your doctor. The doctor may change the type of iron which you have been taking, or he may recommend parental iron also if you cannot tolerate oral iron. Always consult a doctor before taking any medication. Remember that you and your baby need to be healthy. So take your iron supplements and be in the pink of health. Thank you.